Hello, my name is Dr. May, and I'm very glad to welcome you to this lecture today, where we want to discuss the common and the pertinent question people ask us. Can arthritis be cured? And I usually answer yes, but with a condition. The condition that if you could treat your arthritis at early stages with a type of treatment known as regenerative therapy, you can cure your arthritis. And talking about curing arthritis, it simply implies that what actually causes the pain in your joint is the progressive damage of the ligaments and the cartilages of your joint. At a severe stage, it can get to the bone. When we talk about treating arthritis at early stages, what we imply is that arthritis has stage 0, stage 1, stage 2, stage 3, and stage 4. By that stage 3, stage 4, it has gone beyond destruction of the cartilage to affecting your bone. If it is in the knee, that's the point some people start having hair leg or bow leg. So if you can heal that degeneration, you can cure the arthritis. And to heal the joint or the degeneration, it is a journey of 90 days, which is like 3 months in average. Some will heal early if they start the treatment early, some might heal a bit later. And referring to wound, this is a wound in the skin. The skin is a labile joint. If I have a cut in the skin or in my hand, for instance, it will heal with time. How it heals is the tissue of the skin. All these things you are seeing here are cells of the skin. These muscles and the tegment, the cover of the skin. For this wound to heal, these cells will begin to multiply, just as they are saying here. They are multiplying to fill up these spaces, or which is what is called the wound. By the time it fills up the wound, that particular wound has healed. And this process of filling up this wound is what is called regeneration. So by this means, the wound would heal. But this is not possible in certain tissues like the tendons, ligaments, and cartilages, which is what we find in the joints. They hardly heal on their own. So for them to heal, they need assistance. The assistance they need is usually provided by what is known as growth factors and stem cells. Growth factors, which is what we're going to pay particular attention to today, are healing factors or elements in the blood, which is located in one of the cells in the blood known as platelet cell. So when they come in contact with wound, they heal the wound. And these are the growth factors. This is the platelet. So if you harvest the platelet and inject it in the joint that has arthritis, it will release all these growth factors which work at different stages. Like this one is known as platelet-derived growth factor. If you look very well, you see what it does. This one is fibroblast growth factor, epidermal growth factor, vascular endothelial growth factor, and a whole lot of them. They work with different mechanisms, and all of them work synergistically together to encourage the healing. How do we harvest it? We'll take it from your blood. So it's a very natural treatment. So the way we harvest the blood, just like the way we take blood from your vein when we are doing tests. And when you take it from the blood, you put it in the tube. This tube will now be put in centrifuge machine. If you put in the centrifuge machine and you spin it, the idea of spinning it is to separate the blood in different components. What you're interested is in the platelets. You're not interested in the white blood cell or in the red blood cell, which is another, which these are the other cells in the blood. And it's the red blood cell that makes our blood to be red. So when you remove the red blood cell, the white blood cell, you have harvested the platelets. So after spinning, this is how the blood is segmented in the tube. This is red blood. This is the white blood, which is known as white buffy coat. And this is the plasma. So this part of the plasma is rich in platelet. That's why it's called platelet-rich plasma, and that's what you're interested in. So you use your syringe to harvest it, to aspirate it, and to inject. You can see me doing that treatment on somebody's knee and somebody's low back, or somebody that has knee osteoarthritis and somebody that has low back pain that has started compressing the nerves, the walk becomes difficult, the pain is going down to the back of the thigh, so we inject that in combination with a mixture of oxygen and ozone to help the tissue there to regenerate. And when you inject it, just watch what happens. This is the platelets. By the time you inject it, what does it do? It releases all those growth factors mentioned, and they're going to this wound. This is where the degeneration is. It goes there to regenerate it, including the platelets, the stem cells, everything will go there working on the degeneration. And with time, the degeneration will heal, just like the normal wound we have in our skin would heal when you are going for wound dressing and all that. Everything released by the platelets will go there to contribute to the healing. And when the healing occurs, the pain will go. So this is the right treatment for arthritis, not taking painkiller, but heal what is causing that pain. And by the time you heal the degeneration, you have succeeded in healing the arthritis. Thank you very much, and I want to believe that this would help you not to be consuming all kinds of medications, that what can heal you is inside your own blood. If you get that platelet cell in PRP, inject it in your joint, series of treatment is not really, it doesn't heal once. Some people might take this treatment 3 times, some 4 times, some 6 times, some more than 6 times, depending on the stage at which you presented for the treatment. And when that is done, you'll be perfectly fine. Perfectly fine. I assure you of that. Thank you very much. See you again in our next lecture.